All right, so the overwhelming, most commented topic that I've gotten from you guys is healthcare. And I wanted to give you something really good about healthcare because, as you know, there's going to be no politics for the next 5 days. That's the plan I'm trying out. Politics on Saturdays and Sundays. And since a healthcare video was in such high demand, I was really trying to think of something good I could give you on healthcare that would get you through the week, something new and my own. And I came up with what I think is a good comeback for the guy who doesn't want to subsidize fat people's visits to the doctor. You know these guys. Glenn Beck is in this club that love twisting healthcare into this gargoyle where you boil down America to one sick fat person and one healthy skinny person, and the skinny one says to the fat one, hey, you eat 6 cheeseburgers at every meal. Instead of water, you drink melted cookie dough ice cream mixed with grain alcohol, whereas my diet is raw onions, phytoplankton, and rainwater. You make frequent trips to the tin shack shantytowns of small post-colonial despot nations for wild, unprotected, anonymous gangbangs, whereas I put paper down when I pee at home, standing up. I live right. You live wrong. Your iron lung is not my problem, and any Nazi government that uses my tax dollars to keep your broken body alive should be violently overthrown in the name of freedom. And this is a sort of give me liberty and give you death argument. Now, there are a lot of tired, old, poisonous ideas and prejudices wrapped up in this draconian rationale, the foremost of which is the assumption that anyone who is sick did something to deserve it, which is something I think that we believed in the Middle Ages. Your health isn't just influenced by your behavior, it is determined by your sins, and ill health is an earned punishment for the sins of the appetites. And this updates very nicely into the present-day, rugged individualist conservative, I love America, but I hate those freeloading Americans with their luxury asthma medication mentality. You know, a little asphyxiation might teach those people a thing or two about choosing to live so close to the airport. And this is a great way for a Christian conservative to squeeze through that loophole of Christ-like compassion. But in response to that guy who was impenetrable to the moral argument of taking care of each other is the right thing to do, I've thought of an alternative tack that won't work on everybody, but it might work on some. It's an argument on his terms, on his turf. So take the big leap into his world and assume that people who live clean and right don't get sick, that you get the body that you deserve. And then look at Cheeseburger Man. Well, he's got bad habits, and he's in that class of working people that are too rich to collect Medicaid, but too poor to buy insurance, way too young for Medicare, but they have jobs and they pay taxes. Well, I got mail. They have jobs and they pay taxes every week, including Social Security. Tens of millions of people live this life, and many of them fall asleep every night in some kind of pain. These millions are the ones who the current bills in Congress are mostly written for. So Cheeseburger Man, due exclusively to his poor self-control, dies in his 50s of coronary heart failure, simultaneously with liver cancer, sleep apnea, viscosity breakdown, everything all at once, slumps over his desk, and maintenance wheels him away to the chute that goes to the incinerator. Now, the other guy who lived on raw onions all his life, he is going to live to be 102, spending decades collecting the Social Security payments that Cheeseburger Man put into the system, knowing in advance, based on his habits, that he would never live long enough to collect. So if we deny affordable doctor access, other than emergency room visits, to the tens of millions of working lower middle class families who have poor habits but pay their taxes every damn week, then these ill millions are in fact subsidizing retirements that we know in advance they will never participate in. Their money is trickling up. If it is true that we control our health destiny, then the ones who won't last as long are the most entitled to help now. The bill being slowly churned and chewed through Congress right now is an access bill, much more than it is a cost bill. Even if we get the best legislation out of this bill, we will cover almost all of those people in that coverage gap, and we will be a more moral and just society for it, but the work won't be finished. Future legislation and or regulation will be needed to rein in the outrageous costs. The gravy train that pours out of only the American system, paying for unnecessary procedures, labyrinthine medical billing practices, the malpractice industry, insurer profits, pharmaceutical advertising, and even the third rail, too many doctors who make $500,000 a year. These matters will come mostly after the current access-focused legislation, which, if it does well, will turn current spotty access into nearly universal access. For a cost, by the way, if the House bill is the finished product, of about $850 billion over the next 10 years. Sounds like a lot, but per person per day, that's 78 cents. 78 cents a day is your slice of bringing healthcare to those working, tax-paying Americans in the middle who go to sleep every night in pain. You got 78 cents? You know what? I actually have $1.56, so I will cover one Republican crybaby. I will adopt Mitch McConnell as my personal crybaby Republican, and I will cover his 78 cents. If anybody else wants to adopt a Republican baby, you let me know. But you have to be straight because Republicans prefer orphanages to gay parents. On a final, more serious note, a lot of you wanted to know if I think it will pass, or what will it be when it passes, and frankly, I don't know. Nobody knows. This isn't something you can answer with polls and demographics and inductive reasoning. Congress itself doesn't know the answer. We will find out together. But what you can do in the meantime is let your congressman know how you feel at 866-220-0044. Put it in your phone. Then you have it. Hi there. Is this the number I call to leave a comment for a congressperson? Oh, so they've gotten too many comments, so I can't leave one right now. Is that right? Okay, so I should call just anytime during regular business hours on the East Coast? Okay. All right, I will do that. Thanks very much. Bye-bye.